is funny. Hey, I'm new here, sorry. All right, so just so it goes over the sound waves here, now we're, holy buckets. Oh man, anyway, so technology is so amazing and now we're just victims of it, you know. It's like, I couldn't get my thing to open up and I was gonna put in a call for a 14-year-old grandson. Anyway, so welcome to today. We have a lot to talk about. So we're gonna hear from the commissioner and the department about some recovery stuff and RCOs and some of the, a little touching on some of the crisis in group homes and nursing homes. Got 3 bills up. Next week, just if you're planning ahead, on Tuesday we're going to take up, what are we doing Tuesday again?
Tuesday is a bunch of committee bills.
Yeah, we're doing a bunch of committee bills, that's right. And I think Dave Senjum's going to join us for a couple, and Senator Nelson and Senator Rarick. And then on Thursday we're going to talk about we got 3 SUDs. Yeah, Senator Wickland's bill, and then got some bills about independent living, customized. Yeah, Senator Fate, so that'll be interesting. Anyway, just get people thinking about workforce, and I'm transparent enough, hopefully, and not proud enough to not know everything. We have to, when the dust settles, and I don't know how the dust settles on our budget, I do know the dust is going to settle on our policy work. And so if there's only 6,000 people available in the general workforce out there that have graduated from college or high school or whatever to join the workforce, 6,000 for all the teachers and plumbers and whoever else, we have to find ways to get people to come in from the hinterlands to work. Something that came up on a call yesterday, are the MFIP policies that we have blocking people from going to work. So there's an entrance level and the exit level is the same. So if you make enough money to be on it, you are now off of it. Should we consider trying to raise the exit level to help people not be kicked out the minute they're off so that they can maybe afford to work? I think I would like to work on that a little bit. I don't know the answer to this question. Are people in homeless places and in substance programs able to go and do something for a while? I know some of them are blocked by their background stuff, but even part-time, could we get people doing anything? So we just, if not, we're just in a world of hurt. So anyway, let's talk about that later. Today we have the commissioner here, Commissioner Harpstead. Are you there? And so,
I am.
Thank you. And so we've asked you a couple things, and you can discuss whatever you want. You know, you're the commissioner. But to continue the dialogue about the modification of the behavioral health department, and also some discussion about the governor's budget, about how it relates to some of the crises we're facing. And so with that, Commissioner, welcome, and the floor is yours.
Thank you very much, Chair Abler and committee members. Matt's going to put up a presentation. Here we go. I thought just a little bit more about the Behavioral Health Division question since we met last and I testified last on the same subject. So just a few more conversations I thought I would share with you. But first, to repeat, we are just 2/3 of the way through our plan to shore up process improvements in the Behavioral Health Division after overpayment issues 2 years ago. And if I didn't make myself clear the last time I was here, the thought of separating the Behavioral Health Division before we finish this work certainly creates anxiety for me. I just want you to know that that work continues to be top of mind for me ever since I've been commissioner. Next slide. Again, on this question of whole person care, national experts agreeing that the path forward for behavioral health services is integrating them with physical health as the science explores mind, body, spirit connections. In this committee the other day, someone mentioned that Paul Fleissner from Olmsted County was with us for a year on a temporary intergovernmental agreement, and it was a wonderful time. He helped with our process improvements and led our office to a better culture. When his dream company, HMA Consulting, opened a Minnesota office, he jumped at the chance to work there, left us in December. I checked in with him last night, and he mentioned on the phone that he was getting calls from all over the country through HMA Consulting to integrate, not separate, behavioral health with physical health. And so just wanted to point that out because that's one of the things we are thinking about. As I mentioned last time, I would offer that with the opioid settlement dollars pouring into Minnesota's counties, cities, tribal nations, and the state, and as we get back to dealing with what some call Minnesota's other pandemic of substance use disorder, we convene a summit to level set on state-of-the-art treatments, best practices, lay out a human-centered design roadmap to guide the investment of those varied state and local streams to the best return. And we now have the interest of both the Association of Minnesota Counties and March to collaborate on such a summit. So excited about the interest that we have in doing just this. As we come out of COVID and we realize that we've lost some behavioral health capacity in Minnesota, it's a really good time to stop and take a peek at where we are, where we should be going, and lay out a roadmap that we can all contribute to. Next slide. I would offer that we move forward with the governor's proposals in his budget that add up to $92.7 million investment in this space. We looked at these last time, but I just didn't have the dollar amounts attached to them. Next slide. Also, we have learned that other states do indeed have separate agencies for behavioral health. We don't deny that. Other states have done that. And they conduct activities via an MOU with their state's single Medicaid agency. Upon further reading, I found out that one of those 13 that we've been talking about, the Massachusetts Bureau of Substance Addiction Services and their Department of Mental Health, actually report to the Massachusetts Executive Office of Health and Human Services. This is common among states with, quote, separate agencies with a single focus. I've heard many times in my time as commissioner that another state has a separate group of one sort or another. And when I dig into it, I have often found that they actually do report to Health and Human Services if you look at the chart all the way to the top. And so I'm not sure about the rest of the 13. I just happened to get some information about the one in Massachusetts. At least 2 states, Virginia and Connecticut, have told some of our staff that separating behavioral health for them has been, quote, a nightmare. And at least 1 state, North Dakota, is working to put theirs back into their DHS agency. These are just sort of random conversations that some folks have had over the last few weeks, not an exhaustive study by any means. We have read that this can work in states where the 2 commissioners work well together. And so there's no denying that it's possible that this can work out well. I'd be careful organizing state government in a way that depended on personal relationships to work versus a good organization design, but it has worked in some states. Next slide. In other words, I would say from what I've heard so far, this is a far from simple move, and it deserves a deeply researched and well thought out approach before breaking off a piece of the Department of Human Services. And versus some other proposals that have been brought forward about possibly splitting pieces of DHS into separate agencies, this is about one of the most complex splits there is, given the Medicaid relationship. If we want DHS to somehow be smaller and able to have a greater focus, this is a pretty complex step. Next slide. The director of the Behavioral Health Division, I just wanted to make sure we're clear, reports to the Assistant Commissioner of the DHS Community Supports Administration, 2 levels down from the Commissioner. And I have been thinking the Commissioner of DHS has 4 administration assistant commissioners reporting to me. The Governor has 26 commissioners. And in my time, my 40 years of managing in large organizations, sometimes when I have delegated someone to a lower level, they've come back and thanked me that they're finally getting the attention that they need to get their work done. And so elevating someone to a higher level for greater focus and attention isn't always the answer. And I just wanted to offer that as well. Finally, just again would offer that we put the whole capacity of the Department of Human Services with its well-established legal compliance, finance policy, county tribal liaison functions behind these efforts instead of spending the next couple of years standing up a small new agency that would have to add all those functions. And we'd be happy to spend the next 3 years moving Minnesota's mental health, substance use disorder, opioid addiction services to whole new levels instead of working to create a new agency that would have to do the forming, norming, storming we've done over the past 3 years. And that's all I had to add today to what I've already shared with the committee.
Well, thank you, Commissioner. I appreciate it. Forming, norming, and storming. That's pretty good. Am I echoing somehow?
Maybe I need to move.
No, anyway, so this is just a weird technology day. Anyway, so I think this is a good discussion, and I appreciate your comments, and I appreciate you looking into some of the 13. I think I'm interested in looking at some of the rest. And I think the question I'm trying to provoke here, and I take full responsibility or credit, whichever, is what we're doing working? Do we have the right design to accomplish what we're trying to accomplish? And if, you know, and she's not here, but I don't think she'd mind that I quote her, that, you know, Senator Eaton said she's been on task forces and study groups and done so many things over a couple of decades, and things are still getting worse. And so what's not working? And so the question I'm trying to raise is the structure of our leadership cadre in the way of some of the, you know, some of the improvements that might be had across the sectors. And I'm happy you're going to have a summit, which is good. And that means people are going to talk about it some more, and what shall we do, and maybe it'll help, and maybe it won't. So this is the middle of a dialogue. It's the middle of session. I know the other body has some interest in the dialogue. To me, it's all about function. And if you've noticed, I've been keeping Jake's picture up here. Because I want to help us remember that it's about that. It's about the end user. I guess that's not meant to be a pun, but it's the end, the person at the end of the, you know, service function that really matters. And how do we help them succeed? And might be interesting at this summit, which I appreciate you having, you know, one way or the other. You know, maybe if we ask, I don't even know how you get the right answers. I know I was talking to a person, and she said, you don't really have many clients coming to your hearings. You know, you have the service providers and, you know, different people that know a lot about it. But you know what the view is from where they live. And I wonder if you could even do some many reliable discussions about just, I mean, sure that a lot of the people on the front lines know why one person got helped and why one person didn't. But if there's enough commonality in why somebody didn't get helped, that would be nice to know. And Dr. Kelly told us on the first day of this discussion that we need some ongoing, continuous services to this individual, not just 45 days like the VA does and kick them out, or some of the other short-term programs which people do a dozen of. And maybe it takes 12 of those to get their attention finally. And so I think that we're asking maybe the wrong questions. So what is the best way to do it? And then we should ask, what's the best way to administer it? And that just has provoked me to think about this. And at the end, I hope at the end, we don't go home with things being just the same as they were when we got here. So thank you. And I appreciate the dialogue. I appreciate what I sense as great openness to a good discussion, Commissioner. Senator Hoffman.
Thank you, Mr. Chair. And like you had asked, and I presented the overview of what your bill does on Tuesday, and I think it might be beneficial just to look back the three things that you are doing, right? And then the seven simple tasks that your bill breaks out to. And one of the things you got to remember is, you know, having something embedded in a division doesn't elevate those priorities to the top, regardless of where you're at. We talked about this on Tuesday, and I just want to reiterate to you that your bill illustrated, you know, you're bringing that priority to the top, so now the spotlight's on that individual, right? And it's not getting buried in the other thousands of other activities that are occurring. And it should be, the disclaimer here, it should be, because we have people dying every day, because we are not looking at this from a coordinated, integrated approach. And that's because the priorities aren't. Everybody's talking about it, but there isn't anybody that's really guiding that. And it's the system. It's nobody's fault, right, Senator Abler? We talked about this. We structured the system a certain way, and your bill really carves that out and creates. And let me just reiterate what I did on Tuesday. You know, you're placing the individual at the cabinet level, right? And that person now is there. And yes, that person is in the throes of the governor, which is amazing, because at that point, if somebody's talking about reform someplace, they can say, oh, well, do we know we just lost another 1,100 people to the opioid and mental health issues that are happening in the state? And I'm just highlighting that. You know, the second thing, it embeds that person in that cabinet level discussion, right? And we have an epidemic in the nation. We have an epidemic in the state of Minnesota, as I iterated on Tuesday, and I do that again. So that's the two things. And the third thing it finally does is it puts this now at an elevation to have the conversations with the Department of Health and the Department of Human Services about what the commissioner is saying, integrated in the physical and the behavioral side of it, because it needs to be a chronic disease and health care bucket, period, right? That needs some really good movement on the side. So I'm just saying to you, go back to what I had presented on Tuesday of your bill when you had asked, will you do a deeper dive on it? And I did. And, you know, you look at North Dakota, for example, they are not, it wasn't the State Department. If you look at the structure, North Dakota is still a division underneath there, right? But, you know, you look at other states like Missouri who created that, and then some of those were created in 1974. But to your point, Senator Abel, I think the discussion is very valid on saying we're making this a priority within the state of Minnesota. So thank you.
I really appreciate that. Any other comments from members at all? Senator Wickland, actually get to call on her in person. I saw her raise her hand. It's anyway. So maybe thank you for your question and for being here. It's nice to see you.
Let's see. Do I need to do anything else on my computer? I guess I don't need to unmute myself here. All right.
Yeah, the video comes from out somewhere, and then this is you can see the people.
Okay.
Yeah.
Great. No, I just was going to comment that I hope that, you know, simultaneously as if you're going to examine this idea of a different structure, that we also, since we don't have a lot of time this session, that we do focus in on some specific proposals or bills that have to do with maybe, you know, addressing behavioral health or mental health providers in terms of rates or ways we can enhance the professional lives of those who we want to attract into the field. So I know the House has had some hearings about increasing rates and trying to stimulate more entrance into the professions. So I hope we have those hearings here as well, and maybe hear some of the governor's proposals in more detail. So thank you.
Well, thanks. And Senator, I think you're carrying the governor's bill. Is that right? And so if there's some particularly interesting proposals, at least a couple ones you'd like us to highlight, I'd be happy to look at that. I don't know that we're going to dig into every one of those, so, but just I would appreciate your guidance on some of that. And so just to wrap up this section, so maybe, I don't know, whenever this summit happens, and to the county folks and the people that work in the world out there, what is the best way, and what is the best way to organize it? I don't think anybody ever asked the question, Senator Hoffman and Senator Wickland and the rest, and Commissioner. We just inherited this big agency, and there's nothing, this is not it's too big discussion, but it's what's the focus? Where's the best way to guide this? And we said it, there should be a state leadership thing as part of a big group deciding this, and all these little mini groups and counties. And I think if you look at the data and the amount of money we put in, we're losing ground. For every dollar we put in, we lose more people. And it's not that that's a direct correlation, but it's just tragic. So I think we better, last comment, Senator Hoffman.
And I would be remiss, Mr. Chair, my sister-in-law would be here today testifying about the importance of this. But she's not, because she, unfortunately, is one who died and shouldn't have, because of the lack of supports and the follow-along and lack of supports that were there, right? Very articulate, smart individual, had a master's degree in nursing, was high in the top of her class. And it's one of those things that you just sit there and you go, if the system is working so well, why are we still having these unintended outcomes that we shouldn't be having? And I just want to just drive to your point on, you know, keep this alive. Thank you.
Well, thank you. And Senator Nelson, and I think you get the last word.
Thank you, Mr. Chair. You know, I'm so glad. I hope the commissioner is still here. Speaking of times when we're not getting the outcomes that we need, and safety issues and life and death issues, Commissioner, you must be aware, I am painfully aware of the closure of group homes, particularly 10 Cardinal homes in Olmsted County. And I know those homes. I know the clients who live there. I know their families. I know how wonderful those group homes have been for these clients. And now to have them closed on March 4th, I am just grieved, as I know are the clients and the parents or the families. But my question to you is, what can be done? Yes, we have a bill that's working its way, hopefully to the governor's desk, that will provide additional funding for our group homes and to encourage more workers in those group homes. But Commissioner, when these close, this is going to be a cascading effect. It's not like a light switch that we can just turn back on. We don't know where are some of these residents going to be able to live. Their parents might not be living anymore. The parents might not have the capability or the health themselves to be able to care for these adults with disabilities. And I just have to ask you, what are your suggestions and what can we do? You probably saw that I've asked the governor to call out the National Guard, and you might remember I was a little hesitant about that when he did that in our long-term care facilities. I was concerned, but as it turned out, it was a good move. It worked. It helped to stabilize those long-term care facilities, keep residents safe and healthy. And I just, that is what I'm looking for, is an immediate calling out of the National Guard until we can get our funding bill through the legislature onto the governor's desk. But I really would very much like to hear from you, as I know that the residents of those group homes, the remaining staff, the families, people in Olmsted County and really all across our state. What is the emergency plan?
Senator Nelson, I couldn't have given you a better segue question if you wanted. So the next segment we're going to be talking about is that very topic. And I believe the commissioner is prepared to address part of that. We asked her or her staff to come back and explain to us how their $115 million caregiver program will work. In a brief comment about the hero pay, what theirs is. I don't know if we have any handouts on that. And then to talk about what in the governor's budget there is proposed to handle the very question you've asked. And just to help the public understand, in December 21st or 15th, a consortium of groups of folks with disability connections, a whole list, called on the Guard to be called out in December. At a hearing mid-January, I joined that chorus, and now we have Senator Nelson. And we actually had some testimony about that, and that seemed like there was not a lot of interest by the administration at that time. And I hope that your voice now will get them to be more interested in this crisis, how to handle it. So, Commissioner, you've heard those questions. Anybody else had some comments you wanted to make? So if you wanted to join with what you're prepared to say and then move into the question, that'd be great. So thank you.
Thank you, Chair Abler and Senator Nelson. If I could, I would like to start with my overall presentation, and I will absolutely get back to your question. I want you to know, and I think Chair Abler knows, that I have been thinking about and talking to people in this sector of our provider workforce constantly since last October, and imagining the very best possible ways that we can be of assistance in moving forward, and talk to all kinds of folks who are leading these group homes and working directly in them. And I appreciate your concern, absolutely. So if I could just start with an overview, then I will come back to your question. I've come to call this the caring professions workforce. This bar graph is embedded in my brain. It's from the state demographer. It shows the entrance to the workforce over the last 4 decades. Those are the 4 bars in the beginning of the graph, and then the entrance to the workforce over the next several decades. And you can see the very dramatic shift to many fewer people in our overall workforce. Next slide. The caring professions are those frontline workers we applauded throughout the pandemic: nursing home, assisted living, group homes for people with disabilities, behavioral health services, home-based care services, childcare, and healthcare. Together, they represent 15% of the entire Minnesota workforce, a higher percent than other states. DHS likes to say we support 1.7 million Minnesotans in some way every year, which would mean that 15% of the Minnesota workforce serves at least 30% of the Minnesota population. Next slide. The average wage in these caring professions is about 30% below the average Minnesota wage, while the average Minnesota wage has risen 4.3% over the past year as employers compete for workers. While all of Minnesota will suffer from a workforce shortage over the next 4 decades, the prevailing wage in this sector makes it particularly vulnerable. It's also an equity issue. Looking at just 2 categories, childcare workers and nursing assistants, you can see the percent of those workers who are BIPOC, the percent who are female. We have a significant percent of folks in these job categories who are on our medical assistance public health care program and on SNAP food benefits. Next slide. It's also true that the white American post-World War II population was the first in the history of the planet to send its elders, people with disabilities, and family members with behavioral health issues to live with 24/7 staff because it could afford to. Even if we could afford to going forward, we can't staff 24/7 congregate care for so much of our population any more than other countries can. Developments like Amazon delivery, grocery farm delivery, Uber transportation make it more and more possible for people to remain in their own homes for as long as they need or want to. So we will need new models. The independence package that passed in last session with the HHS bill to support home care was the sort of investment we need. But still, that will take some years for new models to be established. You can't change the whole sector overnight, and this sector will need a smooth ramp down, not a cliff. A recent McKinsey report reviewed by the Council on Economic Expansion said that as automation and home delivery reduce the need for retail sales administration and production jobs, the fastest growing sector will be the caring professions with their required social skills that cannot be automated. This is the job vacancy chart, and if you look at the teal wedge there in the 1 o'clock, 2 o'clock part of this chart, you can see the number of vacancies in healthcare and social assistance. Next slide. Key provisions that impact the caring professions include these are bills passed in the 21 session, a PCA rate framework, a CCAP rate increase, early DWRS rate increase, HCBS workforce development grants, provider capacity grants for $590 million. Next slide. These are some of the governors and federal resources that have been sent to nursing facilities over the last couple of years through the pandemic. And the next slide shows governor and federal resources to other providers like the group homes, adding up to $227 million. Next slide. In the governor's proposed budget, he includes a workforce incentive fund of $115 million, a healthcare workforce revitalization package, a CCAP rate increase for the childcare sector, and childcare stabilization supports for a total of $670 million. Next slide. Frankly, I think all the proposals being discussed this session are just the beginning of a discussion we will have for years to come, as the fewer entrants to our workforce will be with us for decades. I appreciate how our HHS legislators understand these issues and are working along with us to find the best possible solutions. I'm also eager to continue in dialogue with the providers of these services across the state, as innovation in these services and workforce retention usually starts on the front lines. Just to go back to the workforce incentive fund that is in the proposals this year from the governor, just to be sure we all understand it. It's a fund that would help providers offer benefits to current and new workers, including retention, incentive, and bonus payments, loan or tuition reimbursement, payment for childcare and transportation costs. Workers could receive incentives totaling up to $5,000 per year. To be eligible, they must have worked in an eligible profession for at least 6 months. And this approach allows providers to decide how they can best recruit and retain workers in their local markets instead of having an across-the-board single approach to the entire state. And so that's that bill. And so that's generally where we are. I think you all know too that we have been working with Senator Abler doing technical assistance for some time, putting together a temporary staffing pool that's in the waiver bill that's currently moving through. That would stand back up a temporary workforce staffing pool like we used to have. We had it during COVID. It expired at the end of December after the legislature had codified it through the end of the calendar year. And then we no longer had the authority to stand up that pool. And so we're pleased that that's in our waiver bill right now. And if that passes, we can stand that temporary staffing pool up again for a period of time. When we started all these staffing pools and when the National Guard was called out earlier, the purpose had to be a COVID purpose. And the National Guard or the temporary staffing pools that were sent in for a short period of time were sent in for a short period of time until a particular facility got over a particular quarantine period or a surge in COVID cases in their facilities. How these temporary staffing pools or the National Guard would apply when workforce shortage is the question is another whole issue that we'll have to talk about. And back in December, I was looking into the potential of getting a staffing pool stood back up again. I talked to the National Guard and asked about the possibilities of that. At that time, we had a federal National Guard mission in Minnesota, and it had to be a COVID purpose to be able to send the National Guard in with that particular mission. And our temporary staffing pools have been designed that way as well. And so people have gone into these facilities for a week or two and then come back out. How that all applies to helping some of these providers through this longstanding workforce shortage is a knotty question that we will all have to think about and figure out. So the temporary staffing pools, whether it's National Guard or these others, are one part of the solution. They don't cover very much or for very long. And so I appreciate that we're also talking about all kinds of bonuses and incentives to try to help this sector of the economy even play the game of trying to compete for workers against the very creative wage competition that they're finding themselves in the middle of. And over time, we're going to have to find even stronger ways to support this sector so it can continue to find its way to a new normal, whatever that's going to be. Some of the same kinds of services that they provide today, and some new kinds of services that will be important to have in a time when we simply won't have the care staff for the congregate care settings that we've been supporting for many years. So I appreciate that we've been in dialogues. Senator Abler and I have been having conversations for months about this very sector and trying to think of the best possible ways to move through this and to support them. And I appreciate the continued dialogue with all of you.
Thank you. So I guess we'll just, there's a lot of stuff to talk about there. So Senator Nelson, was it March 4th or March 8th that the deadline was?
I don't have that in front of me. I think it is
March 4th?
March 4th, perhaps the 8th. The point is, what can we do right now?
No, I was just going to help you out. So,
yeah,
Senator Nelson, I was going to ask, if it's March 4th, Commissioner, that's 8 days away. The proposal that we're trying to get through is on a faster track than any other proposal in the legislature, and that still has to go through finance and get some technical advice. And probably if we could expedite it, it's 2 weeks out from becoming law if we really hurried to start that. The proposal in the governor's bill is still being fleshed out, I think, and it would take some time to get even those grants out the way that's set up. But Commissioner, I think the question that we all want to know, and this is not disrespectful of any sort, but in 8 days, a bunch of people are going to get turned out of their group homes. What is, and you're the head of the agency that's charged with that, working on behalf of the governor who's in charge of all of it. So what should people do in 8 days when they're in the minivan being told they can't live there any longer? Commissioner.
I appreciate this is a very difficult situation, and we've not ever faced it before. We're certainly going to have to put all hands on deck and think about all the possibilities. During the COVID crisis, we were standing with hospitals trying to figure out how to get people out of emergency rooms and into care facilities to see how many people could move to our own DHS, direct care and treatment facilities. And we're going to have, again, all hands on deck thinking about what we're going to do to help people find the care that they need in this situation.
Senator Nelson.
Thank you, Mr. Chair. Well, I appreciate the all hands on deck. That definitely is necessary, but we have to we have to be moving now. We have to start now and start making those resources and those options known to the residents, the families, the impacted families. And I just don't know that there's been any communication from your department to help in this transition.
We have been working with another provider, ACR Homes, that testified here earlier. We've been working to help them stand up the wing of an assisted living facility and to do what we could to vary our licensing requirements to license that facility so they could move a few people there. We did that over the last several months. And so our team is going to have to continue to be creative and find other ways to see what we can do to help different providers in this situation. But certainly the sooner we pass the temporary staffing pool and the incentive system for workers, we'll begin to finally get a foothold into some longer term solutions. But we will do what we can in the department and working with our counties to find care for people who need it until we are able to get additional resources out to them.
Senator
Chair?
Nelson.
Yes, well, just to that point, though, as I mentioned, it's not as simple as turning off and on a light switch. People are going to be turned out of their living situations. They're going to need to find another place to live. And that is not an easy thing to do. And I just would like to know, do you know, I'd be helpful, Commissioner, if you were aware of the Minnesotans with disabilities who are going to be turned out of their homes in 8 days, and if there was a personal contact with them to try and assure that there will be safety and some alternatives available to them. Are you working with Cardinal Homes? I know you mentioned the one aspect about standing up a former nursing home that might be able to serve. I'm just wondering, can you just give us a bit of hope about what can happen right now with these residents in 10 homes in Olmsted County that have received the notice that they're closing? And is there any temporary measure to keep these homes open a bit longer, just to allow the legislation to get a governor's signature and get to provide some relief?
And so, thank you. And so just for people's benefit, on our page, we have this article here about this article here, which is what we're talking about. And so, I mean, I don't know the answer to the question, and I don't know how, I don't know how talking about something is going to help. There's 30 families that are going to be done with their housing on March 5th. They will be, so March 4th comes, March 5th, it's like you have to go now. And so Commissioner, can I help understand the sense of urgency that you feel about this? I think that's what Senator Nelson is trying to get. And so when March 6th happens and these people are wherever, at their grandparents' house or someplace, the reason we have these homes, as you well know, and I'm not intending to tutor you, these people have some cases severe needs. And that's why I think that Senator Nelson is right on track with the National Guard. And not even as a FEMA mission, but as a mission. And so it's nice to get it for free from the feds, but I think this is the kind of thing, if you asked people living in Coon Rapids, do you think we should help people live in group homes? Should the National Guard go? Should my husband, my wife take the weekend off and spend some time helping down in the southeast part of the state to help, these folks here not be out? I think they'd say, yeah. So Commissioner, and we'll wrap this up pretty soon, but I just, I don't know what the answer is, and this is probably the one venue that we're going to ever have a chance to talk about it here. So Commissioner and then Senator Wickland.
Chair Abler and Senator Nelson, we have a community capacity team in our disabilities division that works with any provider that goes out of business to try to find placement and additional services for the people who have lost the services that were available to them. I'm sure we're already talking to Cardinal Homes and trying to find ways to support those folks with additional services. I will continue to do that for other providers if this comes up.
Yeah, so I think this is just the most emergent one. So Senator Wickland and then Senator Murphy. Senator Wickland.
Thank you, Mr. Chair. Yeah, I just was wondering if, for one thing about National Guard, I guess I'd want to know more about, are they really equipped to be able to go into a situation like that and care for the people with the level of needs that they have? So we want to understand that. And then if it does need to fall within some kind of a mission to be able to allocate resources that way, I'd like to understand more about that. And then from your presentation, Commissioner, there is a page with the governor's and federal resources to other providers, and it lists emergency funding to address staffing shortage in group homes and services provided in a recipient's home, and that it looks like the time period is starting April 1st. Do you have any other information about how the process that's going to be used to utilize that funding so that we can understand that better? And then just a comment, Mr. Chair, I just hope that we are doing whatever we can to encourage the House to pass the waiver bill that we passed off the floor to try and get that emergency staffing pool money available. So thank you.
Senator Wickland, thank you. I was going to mention that too. I mean, we're trying, Commissioners, so we put out a bill. It can be cleaned up in about 20 minutes to make it desirable to both sides. And Commissioner to Senator Wickland's question.
Chair Abler and Senator Wickland, the 12A10 funding that we made available, $50 million, that's coming out in April, will be a rate increase to the providers of these services that they can use then to, again, do incentives or retention payments or whatever it might help them to retain staff or to hire new staff. So they have, what they've been working with is the DWRS rate increase that went into effect the first of the year. It comes out in 12-month periods over 12 months. And so they know that's coming, but they don't have it all yet. So we also added this 12A10 statute, $50 million to help them through this period. And then we've been working on standing up the temporary staffing pool, and these other bills are pending. In the meantime, our community capacity team will have to do what they can to help people find the services they need until we're able to get all these other resources in place.
Senator Wickland.
Thank you, Commissioner. That helps me understand it better, and I hope that the providers have an insight into what that will mean to them in terms of the rate adjustments, and so that they can do their planning going forward. But and then, as you stated, you've got teams that maybe can help with these individual cases before that time. So thank you.
Senator Murphy.
Thank you, Mr. Chair, and thank you, Commissioner. And I'm glad, Senator Abler, that you raised for us the article that's in our packet, and I took a moment in Laura Broad fashion to skim the article in the packet. And there's a quote in here that I think we should pay attention to because it's the canary in the coal mine, if you will. It says our staff are killing themselves. They're working all the time. It's difficult as an employer to watch the most valuable asset you have dwindle away, both physically and mentally, because they are working all the time. I think the point at which we're at is not a surprise. And those of us who have been around here for a while know that the people who get their lives, they get their care, they lead their lives in group homes, are often in a place with stable staff who care for them. And that's really necessary, given the conditions that they're living with. So stable staffing, if we care about the Minnesotans who are living in group homes, has got to be a priority. I am, grateful for the National Guard who have stepped in crisis. And I always want to say to those who are listening, those of you who have especially spent a little time in our hospitals, I hope you choose nursing. We would love to have you in the ranks of nursing. It's an honorable profession. And the pandemic has given you an opportunity to see it, and we want you. But I do worry a lot about staffing a group home with the National Guard, especially because this is not a short-term 2-week crisis. One thing that we could do and do quickly is get frontline worker pay out the door to the frontline workers, many who have been staffing this. We would be sending a clear signal to those people who have been staffing our group homes and working under extraordinary conditions, that we see them, we hear them, we care about them. We should do that. It would not be hard. The House has taken it up today. We should get it done. But as I have said before in this committee, we need to address the wages and working conditions of the people who are working in these group homes. And that's not a short-term fix, but I see lots of proposals coming in our way, including what we're seeing today from the commissioner. I am as concerned as anybody else about what we're seeing happen in our group homes. It's no good for those Minnesotans who are counting on us. But we're at the rubber meeting the road, and we gotta not react with just a short-term fix, because this is not a short-term problem. We have to do the hard work in front of us. Thank you, Mr. Chair.
Thanks, Senator Murphy. I have thoughts, but I'll let those comments just stand. And I agree with, the whole intent of that. Senator Hoffman.
Thank you, Mr. Chair. And once again, the committee we serve on your committee is dealing with some real life issues in front of us. I mean, it just seems to be one after another. And Senator Murphy's point, and I'm glad she brought that up, because just previously coming to this hearing, it was meeting with Henry, who works with folks that are CNAs, PCAs, right? He's the organization that he represents, talking about the mandatory double overtime. Somebody comes expecting, a CNA expecting to do a 9-hour shift, and all of a sudden they're doing an 18-hour shift. And he was talking about, and to Senator Murphy's point, they're tired, right? These folks are tired. But the scariest, is that a word, scariest? Yeah. The scariest aha moment right now in this hearing was when the commissioner said, we're talking with an assisted living wing to maybe look at getting some variances. That sends a flag. That's an institutional placement. If we've not done anything to address the system as a whole, Senator Abler, yet we're going to revert back to putting people in institutionalized buildings, that scares me. It scares me to the point that says, are people with disabilities a forgotten people in the state of Minnesota that we're now saying, well, here's the thing? Or are we going to really address what Senator Murphy's saying, let's get some relief on there, right? Or what you're saying all along, let's get some relief, let's get some things. I know it doesn't address the whole system thing, but there's a pivotal point, a decision that's going to be made by somebody that could be a real hurt to people going backwards. I mean, to look at an assisted living wing, I mean, that's just, to me, I say that to you as a saying, that should cause caution in what's going on. And when you say you got hands on deck, all hands on deck, then, what is the assistant commissioner aligned with all those? I mean, there's a whole bunch of divisions underneath the assistant commissioners. What are those policies and what are those processing plans to do this, to take care of this? I think would be something important to bring in front of this committee. Although it might be too late, because to Senator Nelson's point, 10 group homes, that's scary. That is a scary thing to think of, Senator Abler. It really is.
Senator Nelson. Figure you're still there, right? Okay.
Thank you, Mr. Chair. No, my questions were somewhat answered, although I am headed back to home today, and I will be reaching out to some of those families. I think it's just a tragedy, and I'm just looking at some sort of even short-term, just a few weeks to allow these homes to continue to serve. Because as I said, you can't, once they're shut down, it's very difficult. It's not like, oh yes, here we are now. The House passed a bill and the governor signed it. Let's say they just took our Senate bill or a different one. It's like everybody's already out and not sure what options they have. So I do appreciate the commissioner's commitment. And Commissioner, I would like you to email my office, if you kindly would, with the contact of your community liaison who is working in southeastern Minnesota. I'd very much like to connect with that person and make sure that there are some resources and support on the ground.
So,
Thank you.
Yeah. So we're meeting again on Tuesday, and we're way behind schedule, but this is, I think, just really an essential conversation to make us rethink our whole schedule. So, Commissioner, I am not going to even question that you're worried about what's going to happen in 8 days. And I presume there's going to be a bunch of meetings in your office. And the reason I thought that Senator Nelson had a good idea about the National Guard is there's nothing else around to move real quick. If the pool gets set up, maybe you can conjure up a few people. I have no idea how far gone Cardinal Homes is in their operations just to pull the plug. But they decided this in December. And I don't know, so maybe Senator Nelson, you can report back on Tuesday how things are looking. But last I checked, it's winter. And I really don't know what to say besides that. It's like, you know, what in our position, Commissioner and members, we're one body of a two-body legislature working in conjunction with an administration and executive branch. And all we can do in the beginning is propose things. And we tried to be cooperative with the emergency pool, got it out the door. We've got a proposal about $322 million to try to rescue the very likes of Cardinal Homes, which I think might make a dent at least, to stave it off. And then we're in the middle of a system which is largely unaware of the situation. And with all respect, Commissioner, the governor's budget really is pretty silent on what to do for the future. So here we are, and it's just a huge problem. Commissioner, I'll give you the last word, and then we're going to move on to recovery organizations. But I really thank you for coming. I appreciate your transparency. And do you want to say something else?
Yes, Chair Abler, I completely agree with all the concerns that have been raised here today, and I think you know that. I think you know that I came from running one of the largest providers in the state of Minnesota, providing these group home services, and I know the people in them personally. And I'm deeply concerned about how things are going right now and where we're heading here if we don't start to put some pieces in place to help this sector get through this time. We do have this community capacity group that will be working with anyone who's on the edge of closing to figure out a plan going forward. The assisted living wing was a temporary solution. We have no intention of putting people back in institutional settings like that. And so I was just so grateful that it was available in a short term, so we had something to do right off the bat as we continue to look for the longer term solutions. And I look forward to continuing to work with the legislature to get some things done so that we can stand up this sector and help them get through this time.
Yeah.
Thank you.
And I just want to, I said you get the last word, but I guess I didn't tell the truth. Just so you know, even in the letter that was sent by the consortium or whatever the name of the group was that put together that letter in December looking for the guards' help, and I'm off that point right now, but just it talked about, we understand there may need to be a few temporary changes just to, you know, all the independence we wanted and everything. I mean, the first thing is Maslow, keep people warm and safe and from harm, and then on to, you know, more independence and self-actualization and all that. But if you have to do something kind of drastic to help these folks out, you'll get no public pushback from me. But we want them to be safe, but we have to have a long view, and this is just about as ugly as anybody can imagine it being. I mentioned before when we tried to open up the waiver back in 2001. If you can just get in the waiver, you'll be fine. Well, now it's like, it's a card that doesn't buy anything. So anyway, thanks, Commissioner. You're off the hook now, so thanks for spending the time. And I really do appreciate the dialogue, and we're going to revisit this on Tuesday. We have a big agenda, but I think we'll put this up first and just see where things are at. And so, Commissioner, if you can be aware to maybe give us an update, because it is truly 8 days away. So, and Senator Nelson will, talk about that then too. Okay, Ms. Grom, thank you for coming, and hope you didn't screw up your schedule by waiting this long. And I would have thought you were about 15 minutes and being up when we started. So So we had a meeting about community organizations. There's been a lot of dialogue behind the scenes, and you're just here to give us an update about what your early reactions and what you think as a department where there is to go. So with that, welcome, Ms. Grom.
Thank you, Mr. Chair. For the record, my name is Christy Grom with the Department of Human Services. And yes, I do have a brief slide deck to kind of provide an overview of recovery community organizations. I know Mr. Rutherford provided a lot of information in the past couple of weeks to the committee, so I'll do a brief overview and then maybe talk about some of our next steps and where we're at with some of the ongoing conversations that have been had in this committee and then with stakeholders as well. So if it's okay, I will
Please,
share my screen.
Thank you.
All right, so hopefully members can see presentation. All right, so a little bit of history on recovery community organizations. I know folks on this committee do have some background, so I will start at a high-level overview, and I know others have more expertise that they can share as we work through the presentation. So recovery community organizations have been providing services in Minnesota for over a decade, probably think since around 2010 was when the first official recovery community organization really got up and going. Historically, RCOs have operated really relying on grant funding to provide those non-clinical services to people in recovery, really with the aim of providing mentorship to individuals working toward recovery, providing advocacy, peer services, education, outreach, public policy initiatives, and activities of that nature. Mr. Rutherford talked, was it last week or the week before, about 10 best practices in place for recovery community organizations. So I won't go into depth, but essentially these are nonprofit organizations led by the recovery community. They are grassroots in nature. They have a participatory process. They really support all pathways to recovery. And historically, the role of the state and DHS in overseeing RCOs has been as a grant manager, given their primary funding source with grants. So this slide just outlines the statutory definition and kind of the core roles and law related to RCOs in Chapter 254B. So by law, RCOs are independent organizations governed by local communities of recovery with some specified duties, and those are enumerated here on this slide. So just wanted the committee to know that we do have some standards and law related to RCOs and what they are. So while the focus of the conversation here today is really on RCOs specifically, I thought it'd be helpful to provide some context on the distinction between RCOs and peer recovery services. I think for some that might not be intimately involved, we can conflate some of these ideas and get ourselves confused easily. So around 2017, Minnesota began our SUD reform, really honing in on what we need to do to transition our SUD service continuum from that acute episodic model of care that we've talked about to a longitudinal model that really recognizes that substance use disorder is of a chronic nature. And as part of this reform, peer recovery services became available as a medical assistance service. Peer recovery services can be provided sort of before, during, after treatment. Someone need not be in treatment to receive these services. And peers are individuals who are willing to really share their lived experience with recovery. They can often engage much more quickly with individuals than maybe a clinical staff might, providing some reassurance, some support, and advocacy on their behalf. One note about peer support specialists is one of the efforts in Minnesota that we've made recently that members may have heard about is the SUD, the 1115 SUD demonstration that we've initiated in the state. And as part of that demonstration, there is a requirement that we have a sufficient amount of peer recovery specialists to support people with those non-clinical SUD support needs. So when peer recovery services became available, we needed a way in Minnesota to identify RCOs as an eligible MA vendor. And because these aren't licensed programs, they couldn't submit a license to tell us that that's how they would be eligible as a vendor. So At that time, all of them were members of ARCO. And so that was the only entity that nationally had any kind of standard of best practices or levels of accountability or basically tracking each RCO. So at that time, the commissioner required that each RCO show membership to ARCO in order to enroll as an eligible vendor of Medicaid services. So not necessarily tied to intrinsically to being an RCO, but tied to that ability to bill Medicaid for those peer services. And just to be clear, the state does not have any contractual obligation with ARCO. We have not compensated ARCO in any way. So transitioning a little bit to funding, the legislature has established base funding for RCO grants, and you can see that on the slide here. And then members might recall that in 2021, the legislature appropriated an additional $6 million in temporary funding, so $2 million over the course of 3 years between 2022 and 2024, and that was made possible by the Home and Community-Based Services Enhanced FMAP. So a little bit about ARCO, won't go too in depth here, but currently there is only one accrediting body for recovery community organizations in the U.S., and that's the accreditation of peer recovery support services. And both that organization and ARCO are part of Faces and Voices of Recovery, as you've heard in previous presentations on this topic. So that's a national organization out of D.C. The CAPRES is an arm of ARCO, and in order for an organization to become accredited as an RCO by CAPRES, they do need to be a member of ARCO. And currently, when we're talking about the Minnesota Certification Board, there's been some conversations around whether they might play a role in certification of RCOs. It's important to note that this is a certification board that just certifies individuals, not agencies. So they certify individual peers, is my understanding, as well as other kinds of individual entities that provide support to people, but not agencies. They do work in partnership with RCOs to vet kind of some of the trainings that are completed and get peer certified, but they don't presently certify agencies. So we would need to have some follow-up with the Minnesota Certification Board, and we've actually talked with them recently about whether or not they might be willing to perform some of those certification or oversight responsibilities as have been suggested in a part of the recent conversation. So kind of looking ahead and talking about next steps. So at DHS, we have monthly meetings with our RCOs to get feedback, provide information, to listen to the issues that they might be experiencing themselves as an organization or for the people that they serve. In fact, just today we had a constructive meeting with a group of RCOs and stakeholders who are interested in this topic right now. And so we will continue to have conversations with RCOs and stakeholders and really understanding what the issues are. Earlier, I mentioned that there's this new funding available for RCOs. We just received, as part of the HCBS FMAP, and we just received CMS approval to move forward with that particular funding. So that RFP is currently under review by leadership in the Behavioral Health Division, and it should be issued soon. Part of the conversation around that RFP, we have discussed the possibility of seeking additional proposals for interested bodies to provide some of the oversight and membership or maybe accreditation functions that have been suggested. We're not tied to ARCO as a body. I don't think they're tied to being in that role either. So we are certainly exploring all options and having conversations and wanting to solicit some proposals to see what ideas people might have. It's been mentioned in this committee that Minnesota has the fastest growing RCO community, so clearly we're headed in the right direction here. But with that growth, we do want to take a step back and reassess and understand what changes might be needed to better oversee RCOs and support their continued growth. So we'll continue those conversations and would be glad to keep the committee updated, and that's all I have for you today. Happy to answer any questions.
Thank you very much. That was actually very helpful. Questions from members? Okay, I'll just have a couple comments then, since so compared to all we just came from, this is, the concerns about this is actually the good news problem, to have. Probably exacerbated by the money that we were able to get out there, ironically. So And I've had some good conversations as well behind the scenes, Ms. Grom, and I hope that, before we get done with our deadlines, we can have something that can either be done administratively to address the concerns that are there. And I don't sense any bad intent, and I don't know. I think maybe it's growing pains, and I think ARCO has a lot of merit. I'm not sure they were intended to be in the position of arbiter about who gets money. I think they were worried about their group and having some commitment to, purpose and structure and all that. And again, I'm going to offer a thought though, are all the items, so we talked about in the first discussion, which I'm not going to revisit, about the restructuring DHS relative to actually to this very topic, are the criteria that are in place that are important to ARCO important to us? And I think it may be meritorious for us to decide since we've never really passed a law about much of what we want in RCO and even in the function of it. And what's fancy, the name means nothing to me, it's just a name. It could be helping people, HPs, a new acronym which doesn't exist yet. So put that in your lexicon maybe that's foreshadowing. But so is the structure serving the purpose? Are we going to have less Jakes in Minnesota because we have ARCO helping, that didn't come out right. Is that getting us where we want to go without impugning what ARCO is? God bless ARCO and their training, and they just seem like they're a very nice bunch of folks, eager as well to serve. But is it working in Minnesota? Is the structure of DHS, God bless them, working in Minnesota to help us accomplish the mission that we have to take our $21 billion in state money every 2 years and help good things to happen to people? I have to say, so that's my question. And so, Ms. Grom, if you can come back in a couple weeks and let us know what you're thinking and if there's some action we should take. It certainly doesn't rise to the level of emergent like the group homes does, but it does rise to the level of being really important when I see the people who are included and some of those have been excluded from the lists of those who are considered, adequately positioned and good enough to serve people that might take care of a niche which remains unserved and therefore at risk. So, Ms. Grom, you can get the last word if you want.
Thank you, Mr. Chair. We'd be happy to come back and continue the discussion with the committee and hear what your ideas are and share where we're at with stakeholder conversations. And, once the RFP gets submitted, we can alert the committee members so you can see what we're all thinking about and soliciting additional ideas on.
Yeah, and so thank you. So I just thought of something else. Sorry, I lied. You didn't get the last word either. Maybe as we look at the 10 things that ARCO considers important, and I don't think anything of them are unimportant, but what if we came up with our own list? And so maybe, Ms. Grom, if as you talk to folks and as the different RCOs that are doing the work and those people that want to be RCOs, look at that list and get to me, maybe look at those 10 things and are 7 really important and 3 really don't matter much. We should add 2 other ones and have our own little, so it'd be Minnesota RCO. So just see what we can do. So that's my request to the public who are watching and to Mr. Rutherford even, it's just, what do you think, and to the rest of the folks. So this has been a very good segment, and thank you, Ms. Grom. And just because of the schedule, we spent a great deal of time early. I just want to change up the bills. I'd like Senator Wickland, if you're prepared to take up Senate File 3176. And the bill is sitting happily in civil law, but I just want to this is a bill from the department. I actually really like it anyway. We're going to tend to hear all the department bills that come our way out of respect and out of gleaning whatever benefit there can be. We may or may not do all of them, but a lot of them. And if you're watching these highly ranked, this is like the #1 ranked show. I heard from Senate media, this is the #1 streaming committee. So we have achieved something. Us, right here, Senator Hoffman. #1 in streaming in the whole Senate world. So anyway, so for all these, and for my mom, if she's watching, And she has 3 screens going, just to kind of get the numbers up. But anyway, so if there's something you see in these department bills that you really like or really don't like, please let us know. You don't have to testify necessarily if you're shy. But anyway, Senator Wickland, do you want to take up your bill? I guess we can't move it, but if there's a way to, so go ahead, you got the floor.
Oh, thank you, Mr. Chair. Yeah, this is Senate File 3176, and it is a bill from DHS, from the Direct Care and Treatment Division, and it's one of their policy bills. And it has several components to it. 2 of them are changing the frequency of a couple reports. One is to remove some obsolete language, and then there's a provision to establish a new a 60-day voluntary return to secure facility process. And so you have a handout with the proposed process kind of in a diagram form, and then that is in the bill starting on page 2. And I have 2 people here who can better speak to the items. Carrie Briones, and I'm sorry if I'm mispronouncing her last name. And then Dr. Hiratan, who is the Forensic Services Medical Director, are both on the call and available to speak in more detail about. And I'm not sure how they want to divide their testimony, or if I could turn it over to them. Thank you.
Yeah, perfect. Ms. Briones, do you want to go first, or what's your plan? So please present. I think it makes a lot of sense. I think you're onto something here. Not that I would want to go back into there, but at least if they want to go back and be supported, they certainly want to get out again. So, Ms. Briones?
Sure.
Yeah.
And I apologize, I have dogs that just started barking at first. Committee members, my name is Carrie Briones, and I'm with the Department of Human Services. I can speak to 2 of the pieces. We're going to divide this up. I'll speak to 2 of the pieces in the proposal, and Dr. Hiratan will speak to the last one. For the item related to the reports, we were just looking to move them to an annual basis. We had a couple of reports out there. One is related to it's a quarterly clinical report, and it reports on 3 of DCT's programs, and it provides 7 pieces of information about safety, OSHA, budgeted positions, license capacity, and we're looking just to provide that, annually. And the other one is related to our census projections that are provided in the November and February budget forecast each year. And because of the time in which the data is provided, the data is relatively the same. And so we had reached out to MMB, and they've agreed that we can submit it with the February budget. And I can stop at that piece if anybody has any questions.
Questions? That's an amazing pet you have. Did you want to show him to us on TV there? It's like he was kind of peeking behind you there, which I thought was amazing. So a lot of us like dogs. So you're just kind of, so far you're the favorite.
Technology.
So far you're about the happiest favorite segment of the bill, of the committee today. So thanks for the moment. Ms. Briones.
I apologize.
Don't at all.
Oh, gosh. And so the other piece we were looking at was that there's 3 pieces of language that we see as being obsolete, and we would like just to have it removed. The first piece is regarding the enterprise activities, establishing enterprise activities, and it was passed in 1999, and we used it once. And it was to move adolescent services over to an enterprise format. Within 2 years, we weren't able to support it that way, and it moved to an appropriation model. And we have no intention of using that language ever again, so we would like to just remove it. If we needed to do so in the future, we would just reach out to the legislature to do that. The other items had to do with 2 closed programs, the Minnesota Extended Treatment Options and MSHS Cambridge. Both of those closed as a result of the Jensen litigation. So we just would like to remove that as well. And then the final piece has to do with regional treatment catchment areas, and those geographic areas are no longer used because access to services is necessarily limited by geography anymore.
That's very helpful. So Senator Hoffman, you might just want to celebrate maybe or something. This is on the repealer page. Senator Hoffman, did you see the?
Yeah,
Did you find it there?
now it finally hit me. I mean, we did Discovery. That was the discovery on the Jensen Settlement Accord, MITO, to see that being gone is a celebration. I want,
There you go.
And my scare earlier about that, anytime you hear about the institutional settings, it just scares me, Jim. So I appreciate that. Thank you for doing that. I mean, that's a long time coming. It just really,
go.
yes.
Seamus.
Seamus O'Meara, where is he?
Frame this.
Frame this. You want to send it to him?
Senator, that's not a name that maybe some of the viewers at the department are enjoying hearing, but so anyway, that's a previous cadre.
Wow.
So Ms. Briones, do you have anything more to talk about on your part of the bill?
No, I will hand it off to my colleague, Dr. Harachen.
Okay. Thank you very much. Welcome to the committee.
Thank you, Senator Abler, and thank you, everyone here for giving us the time for us to be able to present our bill today. So I'm representing Department of Human Services Direct Care and Treatment. We're forensic services, where we have two separate programs. One is the secure perimeter, where we have all of our patients who are committed as mentally ill and dangerous come and reside at the beginning of their treatment. And then once they progress through treatment, they receive permission through the Special Review Board to move to the non-secure side. So our bill is really looking at how do we make the process easier for patients to move from the non-secure perimeter to the secure side without having to go through the Special Review Board hearing, because that process in itself takes a really long time, minimum of 90 days to 6 months for the process to get started. So, and as you can imagine, with mental illness, patients do have relapses. They do have, for whatever reason, sometimes it's just the nature of their illness where they do decompensate in their treatment and they do need a tune-up. And sometimes that can't be established or accomplished in a non-secure setting. So for that reason, the clinicians on the patient's treatment side would be able to make a decision about safely transferring back to the secure perimeter for a period of up to 60 days. And hopefully within that 60 days, patients would stabilize and then they would be able to go back to the non-secure setting where they had originally received permission to reside there. So this bill really, helps clinicians, helps the patients ultimately to regain that level of independence that they were able to receive in the past. It also will provide them with a process for actually exercising their due process. Because right now, as it stands, when someone decompensates in the non-secure setting, the only way for them to get back is to be, we use the word revocation, but they would have to come back and then they would have to go through the Special Review Board again. And like I said before, that would take minimally 90 days to 6 months, which is a really long time for someone who probably needs only 2 to 3 weeks of medication adjustment or anything else that the treatment team could do. So this really provides them with that due process whereby they could appeal the transfer process. Right now, patients can't appeal that process. So we're hopeful that by allowing us to have that flexibility and autonomy to be able to bring patients safely back into the secure perimeter, that this would achieve, this would be the best for the patient. So that is a very high-level summary of the bill as it stands right now, or proposal as it stands right now. Would be happy to answer any questions, and thank you again for giving us the opportunity.
Senator Wickland.
Thank you, Mr. Chair. I don't have more questions. I don't know if members have any more questions. I thought that this proposal seems like a positive step for patients to have this process available. And if we can do something to help facilitate people getting access to the treatment they need at the right time, this seems like a way that we could add to this, add to the current processes and make it possible for more people to get the right treatment at the right time. So, thank you.
And it's Dr. Harachan, is that, did I say that?
Yes, Dr. Hirachen, yeah.
Oh, Harachan, okay, thanks. I actually am reading the bill, which I actually do for fun. I have no life. But so on line 214 to 216, I totally get that. That's like if they've been transferred out and they can return to the secure facility for up to 60 days. It seems like all the rest becomes the Hotel California. And I don't even know why you need any of that. 217, it says if the committed person is not returned to the original non-secure facility within 60 days, then they're stuck. I don't know. I would never take that risk. And so, and then there's, and they can revoke so they revoke it, now they're gonna petition the special review board. I've been here long enough to know that special review board is not a place you wanna go to, in a political environment. That is, plenty of folks should have got out a long time ago, in my view, based on their constitutional rights. And because of political concerns, which probably I piled on to, they're not getting out. And there's at least one or two administrations that were just not letting anybody out. So can you comment about that? I just don't know why you need, either they get to come in for 60 days, okay, welcome, you can be settled in. But now if we're kind of concerned that you're not really as good as we think you should be, you're not leaving. So can you tell me why you need all that? And I don't even know if I support all that page and a half stuff. So Doctor?
Sure, that's a great question, Senator Abler. So every person's recovery looks different. So some people may need 2 weeks, some people may need 40 days, and some people may need more than 60 days for them to get back to their baseline. One of the beauty of having such a comprehensive treatment program in our facility is that we are able to follow our patients for a while, minimally 2 to 3 years. So we know their treatment pattern. We know how, what level they need to hit before they would be considered as safe to go back to the non-secure side. And what we have really, the 60-day hardline, why we chose that is because majority of patients do recover with treatment with between 40 to 50 days. Actually, 4 to 5 weeks is the traditional time that we look at whenever we introduce a new medication or whenever we adjust medications. Furthermore, we are also trying to make this process parallel to our existing process in our patients who are provisionally discharged in the community. So right now, we do have this process where a provisionally discharged mentally ill and dangerous committed patient, when they're in the community and they decompensate and they need to get treatment and they're willing to receive treatment for us, they can come back to our facility for up to 60 days on a voluntary basis. And so we are trying to make that process parallel as well to that of the non-secure side. So those were the two reasons that's why we chose this. But I can absolutely understand your concern, Senator Abler.
And we can take it offline. So can you just, we're going to move along pretty quick, we'll be discussing this some more, and Senator Wickman, maybe I'll talk to you, but can you list the secure facilities that you're talking about that people would go back to? There's a short list, I'm sure.
So we're in forensic services, we have the forensic mental health program, and then we also have the forensic nursing home. Those are the two secure treatment facilities in our state.
All right. And this is different than MSOP. That's not this program, right?
Yes, those are completely different.
So you're not talking about MSOP graduates. We're talking about other ones. All righty. So I just, and I'll leave this with you now, but just if I'm like the loved one of somebody and like, hey, don't sign that deal, like 217, it says if the committed person is not returned to the original facility within 60 days, it doesn't say why they're not returned. It just, they didn't get back there. There wasn't a bed. They overslept. I mean, I'm just concerned just on the behalf of the individual that you want to draw back in to encourage them to come to this deal. You want it to be really easy for them to get back out. And maybe you don't even need the review board because they've already been let go in the first place. So I'll just think about that if you don't mind, and we'll take it up some more. And do you want a last word, Doctor?
No, those are really good points, Senator Abel.
Right.
We'll try to do.
Yeah, and I know you don't mean anything bad by it. Senator Wickman, do you have a last word?
No, thank you, Mr. Chair. I will talk with the staff and see if there's another, if there are some other words. I can see where not having definition about that, it could, I wouldn't
Yeah.
want it to be a barrier to somebody
Yeah,
taking this, the ability to take 60 days.
yeah.
And
Perfect.
so.
So Senator Wickland, my intention with this bill eventually is we're going to put it all in our big policy bill, whatever the governor's language we can all decide to agree to, we're going to put that in there and some other stuff. So there's a little time. And we can, when it finally comes back, hopefully it can be extracted from civil law in due course and come to us. And maybe they don't need to hear it, I don't know. You'll have to take that up. So that bill is put aside. Senator Hoffman, let's just do, from your chair, you can just do this.
Yeah.
Let's just whip through 3278. 3165 needs a good amount of effort, and it's an important bill. And but just see, we'll check that off our calendar. So
Thank you, Mr. Chair. I just want to point out Senate File 3165, right, the one that's a large amount of bill. I just want to know, did you notice anything about the PowerPoint that you're going to see then on Tuesday when you do this that you might want to comment on?
well, there was some kind of like, I don't know if you're amphibian, but some large animals that like water and land on there that chew down trees at my cabin in Wisconsin.
But what was the largest mammal that we've had in the history of Minnesota
The giant beaver?
the giant beaver. Look at that.
Yeah, I think there's a bill to create that as the state fossil.
Something
I
like
heard
that, right?
Maybe, are you and I working on that?
I think so. And
That was just that was pretty good.
giant beaver was
Giant beaver.
found in your backyard.
My backyard, pretty much.
Size of a black bear is what I heard. Is that true?
Just don't let them bite you. Senator Hoffman moves Senate File 3278 to be in front of us. And go ahead, Senator Hoffman.
Thank you, Mr. Chair, and I'll be real quick. This is it's Jennifer Sommerfeld from the Department of Human Services here as well, but it's the public assistance statutes and just has some technical corrections on it. There are really two technical corrections to Chapter 256P in the statute that just holds uniform eligibility and verification policies across the public assistance programs. There's two sections. I think we'll just get Jennifer, if you want to chat with her, and then we can move this.
Yeah.
What are you going to do, lay this one over, Mr. Chair?
So,
All right.
So I think it might be Ms. Schlick. And I think one of these is a waiver that we passed that we're permanentizing. But Ms. Schlick,
Correct.
maybe I've stolen your thunder. So go ahead. Welcome to the committee.
Senator Abler and Senator Hoffman, thank you. I'm Deborah Schlick. I work in the Department of Human Services in the Economic Assistance and Employment Supports Division. And Senator Hoffman has said the most important thing. These are two cleanups of bills passed last year where there were some drafting errors. They both touch Chapter 256P, which was created to create more uniform policies across public assistance programs. The first is the legislature made a change last year at the request of Anoka County to make sure that eligibility workers could make a phone call instead of just having to mail an incomplete form back. That was changed in one part of law. It deals specifically with MFIP, but there failed to be a corresponding change to the uniform statute in 256P. So this will just clean up that so that the two are consistent. And then likewise, at our request, the legislature helped clean up discrepancies and contradictions between 256P and 256J last year that have been kind of haunting us for a couple of years. There was, we have, based on the statutes, we do not count the stipends that people in a AmeriCorps service program or a rehab program get against their public assistance benefits. That was cleaned up in two places. We neglected to get it cleaned up in a third place in 256P. So this will just make sure it matches all the other changes.
Senator Hoffman.
Thank you, Mr. Chair, and I think that gives the impact of children and families on this, clarifying the statute and supporting parents and children in poverty really is the fix here. And so,
Senator Hoffman, do you realize by fixing this, you will solve certain people's feeling of being haunted? I'm kind of feeling good about that. So that was kind of cool.
well, I'm haunted that we don't have the ability to look at the presentation by Christy Grom that has your giant beavers in
Giant
it.
beaver. Well, another day, Mr. Senator Hoffman. So that, any questions about this?
You're laying this over, right?
It's laid over.
Thank you.
And Ms. Schlick, while you're there, wanted to, I don't know if you heard my early comments, and I can't imagine you wouldn't hang on every word that comes out of this committee, but I had an interesting meeting with some folks yesterday looking at ways to increase workforce, and something I've thought about for a couple of years, and it came up yesterday, I think it was, and about exit levels and entry levels into programming, and how the entry level being the same as the exit level would hamper a person's ability to actually make any money and to become independent. And I know in the past this has been discussed, and we might even have changed it. Hope I didn't ruin it when I did something, but so maybe do you feel like commenting about increasing the exit level and how that might help people, work through the program to become a little more independent, and then phasing out of benefits compared to just a cliff? Do you want to do that for a second, or if you'd rather take it later, we can do that too. Ms. Schlick?
Senator Abler, I think it can at least give you some initial information. So we do, in the Minnesota Family Investment Program, have a higher exit level. When the legislature designed that program, they designed it so we don't count dollar for dollar against earned income, so that people can, as their earned income increases, their benefits decrease, but they don't disappear automatically. There is in the governor's budget a proposal to enhance the impact of that by making sure that we don't immediately change people's benefits when their income goes up, and to create six-month budget periods instead of changing month-to-month budget periods to provide more opportunity to stabilize the income of people who are working, to make sure they're in a more sustainable point before their benefits change. So we'd be happy to explain more about that proposal. And we could certainly answer questions in the future about if there were options the legislature wanted to look at in terms of enhancing that earned income disregard as well.
Thank you. And I guess just to be transparent on my end of it, I would, if you just lengthen the period where you don't have to change it, that just may not encourage work. It might just encourage retention in the program. And if you need it, you need it. And I'm cool with that. We're not having that fight at all with me. But if there's some ways that can truly reward a person who's trying, and so where if they're going up, so I'm interested in that. Senator Wickman, you're looking at me. Did you want to say something?
I just was going to say, I think it's worth exploring. I do think that the 6-month budgeting is a way to help people who have schedules that vary, and it allows them to know that their income is going to be more consistent from the program, and it doesn't punish them for, have things going up and down. So I do think the 6-month provision is also worth looking at, but I would like to see if there are other ways that we can provide, more incentive for people to work as much as they can and not have fears that they're going to totally lose their benefits.
Well, thanks. And the last thing I think we want is for people to try to escape the program and then fall back into it and deprive our industries of a worker who would just be an amazing worker. So, well, I want to thank everybody's attention for today, the commissioner for being such a key part of the beginning. I think we're worried about 8 days from now. And I think it was a good hearing. So we'll be back. We're adjourned. Thank you.